morning.
Okay.
I appreciate y'all being here, and thank you to our presenters for also being here. Today we're going to have from Taylor Financial, Sarah Dixon. Taylor Financial is a good partner for the college. I work with them very closely throughout the year on our benefits and several other things, but she's going to come and talk a little bit about the services they provide to the college, as well as they can provide individual services to you, so we'll find out a little bit more about that. Also, we'll have Greg Farrell from Metlife, our dental plan and long-term disability, and Angela Hazlitt from Blue Cross Blue Shield, and of course Greg Ripke, our Aflac agent. So have put this together for your benefit, to provide you with information and about our plans and how best, hopefully, to help you utilize our insurance. And but just on kind of kick things off, just to let you know where we're at. This is renewal time for our benefits. We're on calendar year renewals. So I've been working quite diligently to get the best possible coverages at the least amount of cost there is. And we've been very blessed and fortunate over the years to be able to communicate reductions in our medical. Unfortunately, I can't announce that this year. There will be a slight increase, but we've had to make a minor plan modification to get our rates a little lower on our renewal, but I do believe it should be a very minimum impact on most of us. I will be sending out more detail by email on the actual cost to the employee on the premium side. What these presenters are going to just talk about is actually the context of the plans itself. We also, on the dental side, we'll see a slight increase. Actually, from the most expensive, which is the family coverage, it's less than $2 a pay period increase, so very nominal increase. Sorry to have to communicate that, but honeymoon's over from the past couple of years. Most of that's a result of having a sort of a rough year claim-wise. Claims kind of went up this year. We're hoping that's just a blip, and hopefully next year things will kind of stabilize and we can get back to hopefully a 0 to maybe another negative increase. Who knows? I might be an oxymoron, negative increase. Anyway, start things off. Sarah Dixon's going to come and speak to us. So, Sarah, you come.
Thank you, Greg. Thank you, Daryl. All right, I am Sarah Dixon from Taylor Financial Strategies here in Rocky Mount. So, as Daryl explained, our role here with the college is similar to that of, let's say, a relationship manager. So we have a very close relationship with Daryl and Human Resources, and really work to make sure that the plan is operating to the best benefit of the employees and the best benefit of the college. Weston historically and now has a great benefits plan, and as we compare even what some of our other groups that we represent offer, they do a great job, and I think a great job of really looking out for their employees. So just a little bit about us. So we are located on Capitol Drive here in Rocky Mount. Shanna Strickland is my partner at Taylor Financial. She was actually here yesterday, and this morning she is attending a costume parade with her 3-year-old. So I'm filling in for her today. So we have been providing financial peace of mind since 1976. I don't go back that far, but our firm does. And so we provide obviously group benefits like we do here with the college, and that's through Blue Cross Blue Shield, Metlife, some other carriers. And our job is really to, again, work with the college to see how the plan is operating, how claims are going. Do we need to shop the plan? Can we compare different plans to make sure that we have the best benefits for the best rates? So we work with groups. We also handle individual financial planning. A lot of what we do is focused on retirement planning. We are licensed with several different carriers and can help mitigate risk through insurance products like life insurance, long-term care insurance, disability insurance. A lot of that you have through your group benefits, but we do work on an individual basis as well. If you have little ones and you need financial or education planning, we can help with that. I think it was earlier this year, we had a Medicare supplement seminar here, and so that just speaks again to our individual planning. So if you're approaching or have approached age 65 and you are eligible for Medicare, we can help you look at options on whether it makes more sense to stay on the group plan or go to Medicare with a supplement. So that's it for us, really. So what we have brought for everyone today is a one-page flyer called Planning by the Decades. It really breaks down things to think about in your 20s and your 30s and your 40s with regard to financial planning. It hints a little bit about how we can help you plan for those things, but it's really just a good piece to get you started if you haven't already gotten started. So yes, thank you for your time, and with that, I think Greg from Metlife is up. Thank you.
Well, thanks, Sarah. Good morning, everybody. Good morning. Glad I cleaned up since I'm on camera this morning. Daryl didn't tell me about that yesterday. But no, it's all good. I'm with Metlife. We've been your dental carrier for quite a while, number of years. Long-term disability carrier as well. Just kind of a refresher on the dental plan and long-term disability. Slight increase in cost, not a whole lot. No change in the plan, so you guys really have a good dental plan and a good long-term disability plan, so some good stability there. On the back, I know some of you guys may have grabbed the benefits summary. If not, feel free to grab one when you leave. It goes into more detail than what the presentation does, but I kind of do what I call the Reader's Digest version. A lot of you look like you're probably too young to know what Reader's Digest is, and some of you probably do know what I'm talking about there. So as far as the plan itself goes, just like always, it allows you to go to any dentist, so you don't have to go in-network to receive benefits. If you do go in-network, those dentists charge about 30 to 40% below what the community charges. So if you did have a big ticket item like a crown or a root canal or some expensive dental work done, it does make a difference. But if you go out of network and you like or love your dentist and you don't want to change, you're good with that, because we still reimburse at a pretty high level for the out of network providers. As far as the plan itself goes, it's going to cover your preventive services 100%. That's your cleanings, exams, x-rays, your once every 6 month stuff. Your Type B services are covered at 80%. You've got a $50 deductible, and those services are fillings, simple extractions, stuff like that. And then your major services are kind of your man-made expensive stuff. That would be crowns, dentures, bridges, implants. If you had to have a root canal, not real pleasant to talk about that at 9 o'clock on Thursday morning, but these things happen. And then your plan's got a $1,250 annual maximum that resets every year. We increased that last year, I think, or this year, 1/1/19 from $1,000 to $1,250. And that actually should take care of about what 90% of the folks probably would need in a given year. That's not to say that if you have that bad year, you could blow through that. But if you look at year in, year out, that's benefit payout. That's going to cover most things. And dental can be kind of, it's typically a lot of that stuff is not emergency type procedures. So if you know you need a couple of crowns, you can get one this year, you can get one next year. You can kind of sometimes plan for that so that you can basically make that plan work for you best it can. Then you've got an orthodontia benefit for those of you that cover your children. That covers dependent children up to 19, and that benefit's a 50% benefit, and it'll pay a $1,000 lifetime benefit. And I do know braces are pretty expensive. They're $5,000 or $6,000, but at least this will help you towards that if you will let me cover your children. So right now, as part of the open enrollment, if you've been thinking about adding dependents or doing something along those lines, now's the kind of time to do it without any waiting period. So we talked a little bit about the network. We've got a really good network in the Rocky Mount area, but again, you don't have to go in network. If you do, it's gonna save you some money. I go to an out-of-network dentist myself, who I've been going to for 35 years before Metlife existed in my mind, and I've never had a problem using the plan. But if I didn't have a relationship with a dentist, or I was gonna consider making a change, or if I hadn't have a lot of dental work done, I would take a look at the network to see if it would be something that I would wanna do that financially would help me out. So the best way to find out who's in the network is just to go to our website, put in your zip code, and it'll show you all the participating dentists in I think a 25 or 30 mile radius. I would encourage everybody to register for My Benefits if you hadn't already done so. That's our online employee portal where you can see your benefits, you can see claims activity, you can see a lot of detail about your plan itself. It'll allow you to get an electronic explanation of benefits. So I've got to go to the dentist Monday for my routine, hopefully just routine checkup. And within a couple of days, I'll have an email with a link that'll allow me to go see what my dentist charged, what my plan pays, so I'll know what my out-of-pocket costs are gonna be, or know what I can expect to get a bill from. So take advantage of that. We've also got a mobile app you can download on your smartphone. And I always like to remind folks, if you're gonna get over $300 worth of work done, have your dentist submit a pre-treatment estimate just so you can see how that claim's gonna be paid before you ever have the work done if it's a non-emergency service. Crown's a good example. I've had to have, it seems like every time I go in for a checkup, I got a crack filling and I need a new crown, which is not good news, but it is what it is, and it's cheaper than an implant. But kind of the moral of the story there is, what my dentist does whenever he says, yeah, this tooth is starting to kind of show its age and wear and tear, he'll submit that information to Metlife along with the x-rays, and within a week or two, I'll be able to get that pre-treatment estimate back to see exactly how that claim's gonna get paid, and make sure that claim's gonna get paid, so that when I go and have that work done, I know exactly what my out-of-pocket costs are gonna be. The other advantage is, if my dentist knows what my plan's gonna pay, he's not gonna make me pay the whole charge up front. He's only gonna make me pay my responsibility, so it really kind of works out well in both ways. So just make sure, dentists are usually pretty good about doing that, but at the end of the day, it all kind of falls on us as a consumer to make sure that's done. And I wouldn't hesitate to ask them to submit a pre-treatment estimate if it's a non-emergency service, or if they say you need this or that, or whatever the case may be. That's not to say you don't need all that, but you may have also used the plan, and maybe you use more of your annual max than you realize, and it might be something that you need to have done, but it's not all that time critical that you could put off until next year. So maybe you've used 1,000 of that $1,250, and that crown's gonna blow through that extra $250, and it may be you wanna wait in January to have that crown done, just so you make sure you kinda maximize the plan for yourself. So before I move on to the long-term disability, does anybody have any questions about the dental plan or dental coverage, or?
I have one on your crowns.
Yep,
Type C, it says 1 in 10 years.
that's replacements.
Okay.
So that doesn't mean you can have one crown every 10 years. It's that crown, if it's a replacement crown, it has to be at least 10 years old. And the thinking there is, most crowns should last, 15 plus years. But that's a good question. That comes up, and it should probably come in every meeting, because you're reading the information, and I'm hoping more people do too, because it does look like that it could say you can only have one, but that's per two. That's a really good question. All right, we'll talk about long-term disability. I mean, this is a great benefit. I hope none of you ever need it, but it's probably one of the most important benefits you have. Dental insurance is nice. Other benefits are kind of nice to have, but a lot of folks, unless they have individual disability, which most folks don't because it's very expensive and it's tough to get, or unless you qualify for Social Security disability, which is also pretty tough to get, this is a safety net, and this is a benefit provided and paid for by Wesleyan. It replaces 60% of your pay after you've been out of work for 90 days, as long as you're disabled up to age 65 or your Social Security retirement age, which for a lot of folks is going to be 67, and it may even get pushed out further as time goes on. So it is offset by any kind of salary continuation, or if you get Social Security, but the thinking there is with a 90-day elimination period that if you do have sick leave or salary continuation or PTO, that you're kind of using that during those 90 days, and if you have a disability that lasts longer than that, then that's when your long-term disability kicks in. And I'm pretty passionate about it because it is probably one of the most important benefits you have. And unless you have it as an employee, either provided by the company or have access to it as a benefit, then most folks just kind of go without it. Unfortunately, it's like a lot of things. They don't realize they don't have it until they need it and start kind of looking around and trying to figure some things out. So this is a benefit that Weston has provided for many, many years. Metlife's handled it for the last few years, but even prior to that, this has been something that they felt like was a real important benefit that everybody needed to have just in case something like this were to come up. So again, there's more detail on that. On the back, there's a benefit summary on that that gets into the weeds a little bit more, but I think most folks want to know, how long do I have to wait? How much do I get? How long do I get it? What does it cost? So that pretty much covers that there. So any questions about long-term disability or any of those pieces? All right, turn it over to Blue Cross.
Thank you, Greg. Well, good morning, everyone. Thank you for the opportunity to come to you today. My name is Angela Hazlip. I'm with Blue Cross Blue Shield of North Carolina. So first and foremost, I just want to say thank you for your business. We've been partners now for several years, and we sincerely appreciate the opportunity to continue to work with North Carolina Wesleyan. So sincerely appreciate your business. Happy Halloween. Did not realize that it was Halloween today. I got to run out and get some candy afterwards. So not good healthy candy. We're going to give out the good stuff around my neighborhood. I will anyway. I wanted to just share with you a little bit today about your medical benefits and what it will look like beginning January 1st of 2020. And that is an elimination right there. 2020 is not a number that I can easily say. The time flies, right? So January 2020, we will go through the benefits that begin on that date. Those benefits will go until 12/31 of 2020. So January 1st to December 31st. I'm also going to not only review your benefits, but I'm going to talk about some of the tools and resources that are available to you that maybe you haven't taken advantage of, maybe aren't aware of. So we'll go through those. We'll also talk a little bit about how best to utilize the plan. So those are just a few things that we're going to talk about. If you have any questions, feel free to stop me. We're just going to run through some slides here, but I certainly want to be able to answer your questions while we have this time together. And afterwards, I'm also available between meetings, so feel free to reach out to me if you have a personal question or something you're not comfortable talking about today. Okay. So to start with, I just want to remind you of the opportunity that you have to get information through our mobile app. And this mobile app is available. You can download it from the Google Play Store, the iTunes Apple Store as well. Just download the app, go to Blue Cross BCNC Connect, and you'll find the app downloaded. And I mention this because everyone will be getting a new ID card for 1/1/20. So be on the lookout for that in your mail. Anticipate that coming sometime in December. Ultimately, that is a new ID card that has a new group number on it. So you will not be able to use your old ID card beginning January 1st. So you'll need to use the new ID card. Okay. But if you don't have your ID card with you, you can always go onto the mobile app that you have downloaded to your smartphone. Simply put in your login ID and password, and the very first thing you'll see is your ID card. So it's an excellent resource. I use it. I don't even carry my ID card with me anymore. I just use the app. So simple and easy to use. But now you can view your claims, you can track your deductibles, look at find a doctor, find a drug. All of that is available, simple and easy to use by point and click. So take advantage of that. Additionally, these are just some better ways to manage your health plan. One of the things Daryl mentioned was the fact that your medical plan is increasing. The reason for that is over the past 12 months, we've seen a significant increase in claims overall. So when that happens, there does require an increase in premium. So it's a slight increase, but there is an increase. So just a reminder on how to manage the plan better. We'll go through these in more detail, but visit your primary care doctor. Make sure you have one doctor who holds all of your records, your medications, that knows your health better than any other doctor. So primary care doctor is an excellent resource for you should you need one place to house your records. So primary care doctor, make sure you choose an in-network provider. Always stay in network, stay in network, stay in network. We'll talk about that more in a moment. But emergency use. Understand that the emergency room is extremely expensive. It's expensive for the plan, it's expensive for you. Let's look at some alternatives, and we'll be talking about that in a moment. Look at cost estimates. How much does it cost for an office visit at one doctor versus another doctor, or how much does it cost for an MRI at this facility versus another facility? Cost estimates are a great tool, as well as drugs. Understand the cost of your medication and what another medication may cost that may be lower cost for you and the plan. Know your health plan. We'll talk about how to access your member guides online. And also we'll discuss wellness and some of the resources that we have available online. So those are just some tools that you can use to manage your health and manage the health plan costs. First and foremost, again, get a primary care physician, someone you're comfortable with, someone that will know your conditions and know the treatments and specialists that you're seeing. It's not required under the plan, but it's always good to have, again, one source and one place that houses your records. Your plan continues to offer office visits at a copay. This health plans now are moving in the direction of taking away copays and going to co-insurance and deductible. So your plan is still offering copays. So if you see a primary care physician, it's a $35 copay. If you see a specialist, it's a $70 copay. Again, I'm concentrating on the in-network side. If you go out of network, that's more out of your pocket. I will tell you, Blue Cross and Blue Shield has 100% of all hospitals in the state. As far as physicians go, we have about 93, 94% of all physicians statewide. So you'd be hard pressed to find a physician that doesn't take Blue Cross and Blue Shield, but know that if you go to a physician that doesn't take Blue Cross and Blue Shield, you'll pay more out of pocket, okay? For urgent care, so these are for urgent issues, for things you can't get into the doctor to see your primary care for. You can go to an urgent care facility, it's $75 copay, that hasn't changed. Emergency room. So your emergency room, you can see, is much more expensive. It's more for you out of pocket. It's $500 to go to the emergency room. Now, if you are admitted, that's waived, all right? But keep in mind, this $500 out of pocket is there for a reason, because it costs so much more for the plan when you go to the emergency room. I will tell you that the number of visits, has doubled over the past 12 months for North Carolina West End. More members are going to the emergency room. And so I would just encourage you to look at other options. Understand that the emergency room is more expensive for you and more expensive for the plan. And we'll talk more about that in a moment. So for preventive care, you may be aware of the Affordable Care Act. The Affordable Care Act under your health plan indicates that you have certain services that are available to you covered at 100%. These are services like your physical exam, for women over the age of 40, it's mammograms. For anyone over the age of 50, you can have one colonoscopy every 10 years covered at 100%. These are excellent benefits, but they are lengthy. There's a number of them, and you have to be of a certain gender, a certain age, maybe even have a certain condition in order to have those benefits covered at 100%. So all of these benefits that are available, required by the federal government to be available to you and covered at 100%, no cost to you. There is a list of them, and and I've put the website up here. I also have some handouts that are available at the table that go through these websites that I'm gonna be discussing. But there's about 15 pages now of services that are available to you covered at 100%. Things like if you're looking to quit smoking, tobacco cessation, you can get Chantix covered at 100%. If you are looking to eat better, you can see a nutritionist. Just get a Blue Cross and Blue, go to Blue Cross and Blue Shield's website at www.bcbsnc.com. Click on Find a Doctor, put in nutritionist, and if you put in your zip code, once you get the nutritionist, you can see that nutritionist unlimited number of times, free to you by these preventive benefits. So an excellent resource, but understand there are also some preventive services, some services that are not covered, that are not considered preventive. For instance, if you go to have your physical and they want to do a vitamin D test is not covered under the preventive services, okay? It is a covered service, right? It goes towards your copay. If you have if you have historically, maybe you, at some point in the past, 15 years ago, you smoked. The doctor may ask to have a chest x-ray. That chest x-ray is not considered preventive. Okay? That chest x-ray will go towards your deductible. Okay? So keep in mind that while you're going through your physical or while you're doing your annual exams, the doctor may want to perform some services that are not on this preventive list, that will go towards your deductible or that will go toward your office visit. So additionally, just want to make sure that you understand, go in network, go in network, go in network, go out of network, you pay more out of pocket. Okay? We're going to talk a little bit about your deductible and out of pocket limits. So in this year, your deductible was $2,000, and for an individual, and family it was $4,000. So as you can see highlighted in yellow, that has changed beginning 1/1/2020. Your deductible will now increase to $2,500 for an individual. Once you reach $2,500 in deductible expenses, you will be then responsible for 30%. Then once your 30% equals total $5,000 in that 12-month period from January 1st to December 31st, once you reach $5,000 as an individual on the plan pays 100% after that. Okay? So God forbid something hard will happen to you, the most you'll be responsible for is $5,000. If you stay in network, okay? Keep that in mind. This is in network. If you go out of network, it's more out of pocket. So just stay in network. As a family, just know that the family plan, if you have, let's say you have 4 people on your plan, 2 of you meet the deductible, then you've met the family deductible. Everybody on your plan, on your family plan, then is in benefit, and the plan will begin to pay 70%, your responsibility would be 30%, and then ultimately, you as a family unit, if you reach $10,000 in the calendar year, the entire family unit's benefits are paid at 100%. So that's the change for this year, is in the deductible. Okay, so what does the deductible cover? The deductible covers hospital services, so inpatient, outpatient hospital services. If you go and have a MRI or a CT scan or a chest x-ray, all of that's going to go towards your deductible. Things like maternity care, even hospice or skilled nursing, durable medical equipment. Okay, so if you're leaving the hospital and they're wanting to give you some crutches, or if you're needing something, a wheelchair, those sorts of things, durable medical equipment, all of that falls under your deductible. Okay, prescription drug. Now, the prescription drug component of your health plan is, I will say, it's the one that's trending the highest. So this particular area of your health plan makes up more and more of your healthcare dollar every year. And this year is no different. It's an extremely expensive portion of your plan. So I want to take a moment and talk a little bit about prescription drugs. Your plan still offers copays. Okay? So for tier, your particular prescription drug program still offers what we call the open formulary. So any and all medications, as long as they're FDA approved, are covered under the plan, except for those that are investigational and things like that. But ultimately, all FDA approved medications are covered. They're just tiered. So tier 1 is your lowest cost medication. Tier 4 is your highest cost medications. Okay? Tier 4 is where your specialty meds sit. So tier 4 would be things like Humira. Okay? Humira is one of the highest cost medications out there, and you're looking at a potential of $40,000 annual cost for Humira. Okay? Your responsibility for that would be 25% of the cost of the drug for a 30-day supply, up to a maximum of $100. So the maximum you would pay for Humira is $100. Okay? Ultimately, the plan would pay the rest. Significantly expensive, high-cost medications are on the market today, and you see them advertised a lot. So if you want to learn more about the cost of those medications, I would just encourage you to go online and look at that. But understand that you still have copays for tier 1 medication at $10 copay, tier 2 medication at a $40 copay, tier 3 medication at a $55 copay. And then ultimately for your specialty meds, you have a maximum of $100. So don't forget, you do have a separate deductible of $100 to meet before these copays take place. But ultimately, this area is where I see the most change. So I would encourage you to speak with your doctor about prescription drugs that you are currently taking. If there is an alternative, if there is a lower alternative for you that would be a lower cost for you, but also a lower cost for the college overall. Understanding that if you're taking a medication that works for you, and then by all means do that. But if you're newly diagnosed and the doctor is just writing a prescription for you, make sure that he understands there's more, you pay more if it's a higher cost medication. And ask and see if there are other alternatives that might be available to you. So I would just encourage you to do that. Prescription drugs, again, just one of the highest costs for your plan. So for 2020, there are some updates and some reminders that I want to make you aware of. The health plan still currently, as it does currently, provides a telehealth benefit through Metlife. What is that? That is a way for you to access a board-certified physician online virtually through your smartphone, through your laptop, through your desktop computer. But ultimately, you're able to have a virtual conversation with a board-certified physician through Metlife. I'll talk a little bit more about that, but understand that today that visit costs the same as your primary care physician copay, but know that that is changing 1/1/20. It will now be $10 copay to have a telehealth visit with an Metlife physician. Just as a reminder, out-of-network services or out-of-state services, if you're having surgeries or you're doing things out of state or out of network, I would just ask to be sure that your doctor is getting prior approval for those things. If not, you want to make sure that you do that. There's a number on the back of the ID card that you can easily reach customer service and indicate that you're needing prior approval for some surgery that you might be having that's out of network or out of state. Beginning 1/1/2020, Blue Cross of North Carolina will be managing the behavioral health services under the plan. All that means for you is on the back of your ID card. Currently, if you have any behavioral health services, you go through Magellan. It's just a third party that we work with. Ultimately, we're bringing all of that in-house, and our nurses will be handling those behavioral health prior authorizations moving forward. Prescription drugs, again, I say this every year. We at Blue Cross and Blue Shield review our formulary every quarter. So it is possible that a drug that you are taking today may change and move tiers from a tier 3 to a tier 4, or from a tier 3 down to a tier 1. So you may be getting a letter from Blue Cross that indicates that your drug is changing tiers. or it may even indicate that your drug is now requiring prior authorization where it hasn't in the past. The reason for this is that if a drug has hit the market, that it may have additional additional uses that may include a cosmetic purpose. So if that's the case, then we want to make sure that the drug is being utilized for the right purposes, so we may ask for prior authorization from your doctor. All it is a point and click for your doctor to give us the doctor's notes to get that prior authorization. But understand, if there are any changes to a medication you're currently taking, you would receive a letter from us. But that happens every quarter. Specialty medications, know that if you're taking one of those specialty medications in that Tier 4 category, you may be required to get it delivered to your home through Alliance RX Walgreens Prime. Certainly, these are limited drugs that can't go through a pharmacy, that have to be delivered to your home. Site of care for infusion, this is just a reminder, this happened actually in 2018, but I want to make sure that you guys are aware of it. Should you have infusion therapy, know that that is being offered at doctors' offices or at ambulatory care centers. If you should need that infusion at a hospital setting, that would just require doctor's approval or a doctor's note. So just know that infusion medications are now being done at doctor's offices or at ambulatory care centers. Just a reminder, make sure you log on, click on the Find a Doctor tool. You can get cost and quality information there as well, so be sure to use that. Emergency, again, you guys have had an increase in the emergency utilization over the past 12 months, so I want to talk a little bit about some alternatives. We mentioned telehealth a moment ago. Understand that telehealth is just a lower cost to you, it's a lower cost to the plan as well. If you have any of these types of symptoms, you're not sure if it's what it might be, but if you know it's a cold or sinus problems, ear problems for kids, this MD Live telehealth benefit is available to you 24/7, 7 days a week. So it's an excellent alternative to going to the emergency room. And again, you're seeing a board-certified physician, easy access. I'm going to tell you a little bit, it works just as it would if you were walking into a doctor's office for the first time. They're going to ask you your medical history, right? So if you log in today and you create a login and password, you go ahead and set up your medical history, then the next time that you go in, you can schedule an appointment with a physician, and if it's just for the acute care services, just know that they'll get back to you within 10 minutes. It's very quick, and again, they provide prescriptions, so if you just need a prescription for something, they can call that into the pharmacy that you work with. You can access MD Live just by downloading the MD Live app. There's an app for everything. Go to mdlive.bcbsnc.com, or you can call them. All three ways to access MD Live. But I encourage you to use that as an alternative to the emergency room. Know that you have Healthline Blue, the nurse line is also available. Healthline Blue is a 24-hour nurse line. Again, RNs are working that number 24 hours a day, 7 days a week. I always use the example. Had a member that came to me, had used it when her child got stung by a bee. She wasn't sure that he was allergic. So the nurse walked her through some signs to look for to determine if the child was allergic or not. So it was very helpful to this particular member, but know that that's an option to the emergency room. Understand your costs before you go to whether you're going to the emergency room, whether you're going to for an office visit or an MRI. Understand the cost to you as well as to the plan. You can do that simple and easy by logging onto our website and look at the cost for, just click on Find a Doctor and it will show you the cost when you compare facilities. If you're looking for an MRI, you can compare different facilities and what one hospital might charge for the MRI and what another might charge for an MRI. Very different. So take a look at that. You can also manage your prescriptions and the cost for those. Again, click on Find a Drug on our website, and you can type in the name of your medication. It will show you the cost. It will show you if there are alternatives under that same therapeutic category. You can look at the cost for yourself and the cost for North Carolina Wesleyan. And to know your health plan better and what's available to you, I would encourage you to look at the member guide. The member guide is it's like a 50-page, 60-page document that sits out there on our website that you can download, you can look at, but it gives you the details behind the benefits summary that I provide you that's on the table, and that Daryl may put up on the website. But the guide is actually a larger document that goes through the detail for you. You can see explanation of benefits for every claim that has come through our system. So know that all of that sits out there on the website. Last but not least, talk a little bit about wellness and some of the tools and resources that are out there. You have when you log on to our website, there is a personalized homepage. The first things you're going to see are your claims information. How much of your deductible have you met? All of that information is going to be out there. But at the bottom, if you scroll down on your personal homepage, there are little tiles that sit out there. And one of them is called Blue Rewards. If you click on Blue Rewards, there may be an opportunity for you to earn a gift card, and we typically send those through the mail. It's basically a code that you get that you can log on to our site and get download a gift card for Amazon or Best Buy or those places. But these gift cards are available to you if you should register online, if you haven't registered, if you indicate your contact preferences. Let's say you want to be reached by email versus phone, or if you want to be reached by phone versus text. However you might want to be reached, just indicate to us via contact preferences, and you get a gift card. And, typically there's a $10 reward for each one of those items that you complete. So take a look at it. You may have benefits out there that you're not aware of. Also know that there are discounts. So if you go to specific vendors within a certain zip code, you're able to get a discount just because you're a Blue Cross and Blue Shield member. You can find that under Blue 365. So if you go onto our website, click on Wellness, and then underneath Wellness, you'll see a link for Blue 365. If you go to that link, you're going to see coupons. There's a coupon out there for Reebok tennis shoes. You're also going to see this vendor discounts. Just type in your zip code, and it will let you know vendors that offer discounts as your Blue Cross and Blue Shield member. Okay, so take advantage of those things. Know that, and don't forget about the nutritionist. If you're looking to lose weight in the new year, that's an excellent resource for you and cover that 100% under your plan. There's a look at your personalized homepage. But hopefully that gives you just a quick overview of your benefits, what's available to you, also what's changing for 1/1 of 2020. Any questions that you have about what we've talked about? I know I went over it very quickly, but hopefully it gives you, again, a broad level overlook of your benefits.
Is there a cost for the Blue 365?
There is a cost for some things. For instance, fitness centers. So I signed up for it, and I did the fitness centers, and it charges me $25 a month, and I have access to 7 different gyms within my zip code. And that's a much better deal that I'm going to get if I were to walk in one of those fitness centers on my own. And it's so there are some services out there on Blue 365 that do require upfront cost.
But to join it, there is no cost.
There is no cost to join it. Any other questions? Okay.
If I go out of country,
If you go out of country,
what is my coverage? Will Blue Cross, that's considered our network?
well, there are some Blue Cross and Blue Shield providers that are out of country. Okay. What I I will tell you that you can go online and look at Blue Card Worldwide, and it will show you what's available to you. Understand that before you go, though, there are, so for instance, the physicians that you see overseas or in another country, they aren't going to be able to send a claim over to Blue Cross, right? So you pay up front, and then once you get back, you submit the claim, and then get reimbursed. Okay, so that's the type of coverage, and it's limited, right? It's going to be specific places that have the coverage. So I would just say call first, and you can call the member services number and they'll direct you. But I would certainly call first to make sure that you know if there are providers located in the area. Understand emergency coverage is always available. Okay?
So if I'm in an accident?
Yes.
Same thing in the States, in the United States?
Yes. Any other questions? All right, guys. Thank you so much for your time. I really appreciate it. Now I'm going to turn it over to the Aflac guru, Greg. Thank you.
Thanks, Angela. Good morning, everybody. All right. Well, we're going to talk about the duck and a couple other things that we do, and we're glad to be back here this year, and look forward to meeting with you next week as you have time to do that. It's your coverage, and it's not a cookie cutter type thing where you can, like the Blue Cross and the dental, or those are certain things that are in place. With Aflac, you can protect what you're passionate about, and the situations they're talking about is basically money that you would have to spend, or you would probably save for those areas, but maybe it's taken away because of a medical situation. We pay the money directly to you. Here's a list of the different programs that we make available. Hospital confinement, the accident, the cancer, which has a specified disease rider on it, critical illness, which is more defined as heart attack, stroke, bypass surgery, the dental plan, which is a supplement to the Metlife plan, where it can pay another $1,400 on top of the $1,250 that Metlife is doing, and we have a vision plan as well. But these programs are just basically your programs that provide you with cash money at the time you need them. We've had a lot of claims over the years, and I'm glad to say that we've not raised our rates in 28 years that I've been working here not been 28 years, since 2000, not 19 years. I'm 28 years with Aflac, so I'm getting the numbers mixed up. And then some of you know about the one-day pay issue, where I had one client yesterday telling me that he processed a claim, and then 2 days later he actually had a check back in the mail. If you do it online and sign up for direct deposit, you can very possibly have your money back the next day, and I've had that happen to me several times with some claims on my wife. So our one-day pay is pretty awesome to get you your money when you need it. So that concludes the Aflac part of it, and as mentioned earlier, Daryl sent out some dates in the, what's that called, the Doodle app? Yeah. So you can doodle around and set up an appointment next week, and I'll be on campus 4 to 5 days next week for that. All right, Kim, let's go to the next one. I'm glad she's running that. I'd be so frustrated.
Your video gives me trouble.
It's not my fault. All right, y'all get ready to bounce around with me. This is the Halloween shuffle. Okay? Last year we introduced Community Eye Care, or CEC, and it went over pretty well. It's again available this year. No increase in rates. So if you were thinking about signing up last year but did not do it, certainly have the opportunity to do so again this year. job on that. The next two components we're going to talk about are the flexible spending account, and the first one will be dealing with the dependent care flexible spending account. Many of you participate in that, and one thing you've got to be aware of, it does not roll over. It does not assume that you want to utilize that benefit next year. So that's one reason it's mandatory to come in and talk to us to re-up for that, because your children get older and they don't need child care every year from year to year. And I know that's exciting but sad at the same time. But you can put up to $5,000 a year into this account, and the beauty of it is you're saving tax dollars on those monies with that. Not only can you use it for child care, some of you may be taking care of your elderly parents, and that's an eligible benefit under that as well. Now we can move on with that. And again, it has an app on it, which you can keep up with the amounts that you're spending and see your claims, and even file claims on that. The next and the last thing that I'll talk about is the healthcare flexible spending account. Again, you don't pay taxes on those amounts. No federal, state, or Social Security taxes are deducted. You can save as much as like 30%. So just imagine $1,000 that you put into that in that year's time. That's saving taxes on $1,000. You probably have to make you have to make $1,300 to have the same buying power on this. And if this has a carryover, we've used the carryover for several years now. The IRS allows up to $500 a year to carry forward into the next year and utilize those monies as well. So it's a great way to save taxes, and it's preloaded. We give you a card. Many of you participate in that, but we preload a card with the amount that you obligate for on the healthcare savings account. And back on the former slide with the dependent care, it's not preloaded for the full year. It's loaded every time you get a paycheck, and then it eventually catches up. Any questions on any of those areas that we need to talk about? If you have any individual questions, I'm hanging around as well, and then I'll certainly be able to see you next week to do that. I look forward to that. Thank you very much for coming today. Daryl, it's all yours. Probably don't need this, but I'll give it to you.
Okay, thank you again for being here. Hope you may have learned something today. We provide this meeting again for your benefit and just hopefully to make you more aware of what's available to you, provided by your insurance coverages. Thank you to the presenters again for being here. I always appreciate them, enjoy working with them. We all look at this as a partnership, which includes all of us, you as employees and users of our benefits, and also the providers. So we all are in this together. So again, appreciate all that you can do to help us keep our costs down. It benefits everyone. Just a reminder, if you have not signed the sign-up sheet for the drawing, we'll do that at the end of the next session. So make sure you have your opportunity to win that $100 gift card. And again, thank you to Taylor Financial for providing that. Also a reminder, Greg mentioned it, but I'll also say it, next week he will be on campus having the individual meetings. If you have an AFLAC policy or interested in an AFLAC policy or interested in re-enrolling into the flex spending plan, you will need to meet with him. Always a good time to meet with him just to review what you have. Or if you just have questions or need information, he will be here all next week. We have him set up on 30-minute interval meeting schedule. He'll be in the Pearsall Library in the Hardy's Rives room. And as I said, it's online. You've seen the emails that I've sent out. I will send them out again as a reminder. If you have missed the link, you can just click on the link, choose a time slot that's available, it meets your schedule, and you can meet with Greg. The presenters will be around for a few minutes between sessions, so if you have any questions for them, please take advantage of them being here. There's lots of materials at the tables. If you haven't picked up those items, please take advantage of them.